Now, St. Kitts and Nevis, we are preparing to implement or roll out our COVID-19 vaccination campaign or plan. And so, so my task this afternoon is to provide you an overview of our national COVID-19 vaccination deployment and implementation plan. So I'm going to speak to access to the COVID-19 vaccine. I'm going to speak to distribution and then acceptance. Access. And so the Federation has signed on to the COVAX facility, which is a global mechanism that provides us access to COVID-19 vaccines. And so we would have received a letter about 2 weeks ago telling us that we would be allocated vaccines from AstraZeneca Oxford. And then 2 or 3 days ago, we received another letter confirming that the AstraZeneca Oxford vaccine has now been granted emergency use listing by the World Health Organization and is thus authorized for distribution under the COVAX facility. Our allocation of about 21,600 doses will provide coverage for approximately 20% of our population. And we have been told that during the week of February the 22nd, we will receive further information regarding our final allocation of doses to be provided between now and May of this year. Towards the end of last week, the Federation would have received a generous donation of 2,000 doses of the AstraZeneca Oxford vaccine, 2,000 doses from Dominica. The Federation is seeking access to further COVID-19 vaccines through other mediums or mechanisms. Access to the COVID-19 vaccine is crucial to curbing the spread of this pandemic and restarting our own economy and economies in the region and globally. Distribution. Now, in terms of vaccine cold chain, in St. Kitts and Nevis, we are presently improving and expanding our storage capacity for vaccines at the central medical stores at the JNF General Hospital and at Alexandra Hospital. And so these would be our principal storage points, but then vaccines will also be transferred to the Poxon Hospital and Mary Child's Hospital, where we have generators. And then on the vaccination days, vaccines will be transferred from these storage points to the point of service delivery, where are the vaccination sites. So in essence, the health centers are the designated vaccination sites. So yes, in St. Kitts, 11 health centers, Nevis, 6 health centers. These health centers will be deemed our vaccination sites. So at present, the Ministry of Health, we are ascertaining our state of readiness for the rollout of the COVID-19 vaccine. And so each health center is tasked with ensuring that they have adequate supply of, syringes, needles, alcohol swabs, etc., everything that would be required to administer this vaccine safely to our people. Training. Our community health team, meaning our nurse managers, nurse assistants, they are being trained in terms of vaccine administration. So Pan American Health Organization is providing us the technical support in this regard. We have been advised that we should use an appointment system, and so individuals will be given appointments, dates and times when to come in for their vaccine. prioritization and targeting. So as I said before, we have been allocated about 21,600 doses. We've received 2,000 doses last week. And so at present, we have coverage for approximately 20% of our population. And so we are going to have to prioritize and target the priority groups in the initial stages. And so the National Immunization Committee would have met and determined the target groups for the various stages. And so we will roll out this plan in 3 stages: stage 1, stage 2, stage 3. And I will give you an overview of the priority groups in each of these stages. And so in stage 1, we have stage 1A, healthcare workers who are working in the front line. This includes all the specialists, internists, doctors and nurses working on the COVID-19 wards, St. Kitts and Nevis, the operating theaters in both islands, ICU, emergency room, and all the nurse managers and the nurses who go and take samples at various quarantine sites and at the hotels, and also the personnel working on the ambulances. Stage 1B includes the border protection staff working on the front line along the corridor of containment. So this includes port health staff, immigration, customs, ground transportation, and hotel workers on the front line. Stage 1C includes the executive arm of government and essential workers outside of the health sector, and these include police and defense force, coast guard, fire and rescue. We will also look at or target older adults with chronic diseases, meaning those chronic conditions that places them at higher risk for severe COVID disease. So that means older adults with diabetes, respiratory conditions like emphysema, asthma, renal disease, and autoimmune conditions and coagulopathies. We are also advised to have an emergency reserve of vaccines for utilization in the case of an outbreak, meaning clusters or even community spread. So these are the target groups for the first phase of our rollout of our COVID-19 vaccination. So in terms of stage 2, I'm going to describe the priority groups in the second stage. Healthcare workers who are at moderate to high risk, and these include those working in nursing homes and home care services, laboratory staff, etc. We are also targeting older adults with no or one comorbidity. We are also looking at persons under 60 years of age with chronic diseases, so that the middle age group with chronic diseases. And then we are also going to be targeting socioeconomic groups, including low-income migrant settlements, disadvantaged persons registered in the Social Security benefit systems, persons with disabilities, low-income groups, hard-to-reach populations, and persons with mental disease. So these are the target groups for stage 2. Stage 3, we will be targeting all the staff and teachers in the Ministry of Education from the early childhood phase to the tertiary level. And then we will also target essential workers outside of the health system. And these include municipal services, other civil servants, persons working in agriculture, the food industry, ground and sea transportation, etc. We will also target social employment groups like prison workers and residents, persons working in the manufacturing industry, persons at New Horizon Detention Center, Children's Home, and the offshore medical school dorms. We are going to also include all other persons in the society in this phase or in stage 3. And so this would include all our young adults and middle-aged adults who may not have any chronic illness. And so based on the target groups, I would have described everybody in our society would be covered. At present, the Ministry of Health is collaborating with the IT department in developing a registry which will be populated with the names of the individuals in the various target groups I would have just described. And we are also developing a database whereby we will be able to monitor vaccine safety. So in other words, once you would have received your COVID-19 vaccination, we are going to follow you up for a minimum of 3 months. So it's going to be 3 months and more, just to make sure you, or to capture any of the side effects that you would have experienced having received the vaccine. And we are going to capture this data in our database. Now, once you would have received the vaccine, you will be issued a COVID-19 vaccination card. And so once you've gotten your first dose, your card would state dose 1, date, you will be given an appointment for your second dose. Once you would have returned for your second dose, it would be recorded, and so your vaccination card will be given to you, and so you can use it as needed. The Ministry of Health has also developed a comprehensive communication strategy. And this is important because we must inform the public, educate the public about this vaccine. And education and communication of this nature precedes any rollout of any vaccine. And so it's our job to provide you, the general public, with the facts as we know it about COVID-19 vaccine. We will provide you the facts such that you can make an informed decision and accept the vaccine. We intend to use the traditional media and digital media platforms. And I want to use this opportunity to invite volunteers, advocates who want to work with the task force and the Ministry of Health in staging an effective public education campaign about COVID-19 vaccine. We cannot do this alone, and so the task force and the Ministry of Health, we want to engage the key stakeholders, meaning those within the government and those outside of the government, in the private sector, NGOs, civil society organizations, to come on board. From last year to present, we've used an all-of-society approach in our response to COVID-19, and it continues. And so we need your help in order for us to successfully roll out this COVID-19 vaccine campaign. And in order for us to be successful in achieving the herd immunity threshold, we need all hands on deck. In terms of the regulatory framework, we are collaborating with the Attorney General's chambers in making sure all the T's are crossed and all I's are dotted in terms of our regulatory framework. And of course, we can't accomplish much without adequate resources and funding. Okay, so as I said before, we would have received 2,000 doses of the AstraZeneca Oxford vaccine, and then the COVAX facility has indicated that we will be allocated this vaccine, the AstraZeneca Oxford vaccine. And so I want to use this opportunity to provide you additional information about the vaccine that will soon become available to you. It has an efficacy of about 63% against symptomatic COVID-19 infection, and then WHO has confirmed that this efficacy is increased up to about 82% if the second dose is given within 8 to 12 weeks. So in other words, if you receive the AstraZeneca Oxford vaccine, you have a 63 to 82% risk reduction in terms of your picking up symptomatic COVID-19 infection. This is what this really means. So there will be a 63 to 82% risk reduction in your picking up symptomatic COVID-19 infection. It requires 2 doses. The vaccine is stored in a regular, normal refrigerator at about 2 to 8 degrees, and we can store, the vaccine can be stored adequately in this condition for at least 6 months. We will be giving this vaccine to persons 18 years and over. And so if you are in one of the target groups I would have mentioned in stage 1, you will be given an appointment. You will be asked to come into the health center nearest you, and then you will be given a tiny injection. It's just a small dose, 0.5 mils, 1 dose, 0.5 mils, and as an intramuscular injection in your deltoid muscle. You will be given an appointment to come back in 10 weeks to get the second dose. When you receive the vaccine, you will be asked to remain seated for about 15 minutes, for at least 15 minutes after the vaccination, just so that you can be observed, and once you are free of any side effects, you'll be free to leave. So this is just an idea as to what will happen when you go in for your vaccine. Now, what's the ultimate goal? As vaccine availability increases, we hope that there will be recommendations to expand and include other groups, like the younger, like the teenagers. Now, our goal is for everyone to be able to easily get a COVID-19 vaccine as soon as large enough quantities of the vaccine are available. While we work towards rolling out a safe and effective vaccine, we must continue the essential public health actions that are needed to suppress transmission: wearing of the face mask, hand hygiene, physical and social distancing. Now here comes the big question. And I think we all have to ask ourselves the big question. Can you go back to that slide for me, please? If you were given a choice of, well, you will be given a choice of receiving or choosing to receive the AstraZeneca Oxford vaccine. So that's one choice you will be given. Or be exposed to the COVID-19 virus. Which would you choose? I have chosen to take the AstraZeneca